As a surgeon, we often time poor and have lots of things to do in a single day, and there are things we try to cut corners, especially in the process of getting a consent. Take it from me, as an orthopedic surgeon with quite a few years of experience, it is important that the patient understand what procedure he or she is going for, and therefore getting an adequate consent.
It's critical to use a healthcare interpreter when obtaining informed consent from a patient so that you can determine the best outcome.
When the doctor is obtaining informed consent, the priority must always be on patient-centred care. The informed consent process involves ensuring the patient gets enough information and ensuring that they fully comprehend that information so that they can make a decision for themselves. I recall an incident from the perioperative unit several years ago where there was a 75-year-old patient of Russian background, and he attended the pre-anaesthetic clinic with his daughter. We gave the patient instructions about fasting before his operation. We told him to not eat or drink after 12 midnight because he was going to be having morning surgery. The anaesthetist and the nurse both conveyed that information to the daughter, and it was understood that the daughter had conveyed that information to the patient. However, on the morning of surgery, when the anaesthetist went to call the patient in, they found the patient munching on a chocolate bar and drinking a cup of coffee in the waiting room.
There are also a number of issues that can arise if you don't have accurate informed consent. For example, you don't take into account the patient's religious or cultural beliefs. You can delay surgery, you can have a prolonged stay in hospital, and there can be complications that are unexpected from the treatment that you give the patient. If you don't obtain a valid informed consent of a patient, you can be charged with assault. It's very important to know what problems the patient has had in the past and what their current health issues are. I remember a very specific example of where a healthcare interpreter was invaluable. We had an elderly, non-English speaking Chinese woman who was coming in for elective surgery. She came in with her daughter, who mentioned to us in passing that she'd had a terrible problem with the anaesthetic last time she had an operation in China. To me, that could mean the patient has a problem with nausea and vomiting afterwards, but it also may be a catastrophic problem such as anaphylaxis, which may have led to a prolonged stay in hospital and even intensive care. Through the healthcare interpreter, we could work out which of these two scenarios occurred. Luckily, it was only a bit of nausea and vomiting, and the outcome of the surgery was actually quite good.
It is very tempting to use bilingual staff in a busy day to attain a surgical consent. But again, it is difficult to assess the competency of that staff member in delivering your message across clearly.
It's always tempting to use a family member or a bilingual staff member as an interpreter instead of a professional interpreter. However, family members can be unreliable interpreters. They may not have adequate language to be able to convey the information to the patient. Also, the patient themselves may not want to discuss their previous medical history or surgeries in front of the family member, and they have a right to privacy and confidentiality.
I can recall a clinical scenario. A colleague of mine, she's an orthopedic surgeon. She was referred a Thai-speaking patient for consideration of either total knee replacement or arthroscopic surgery to his knee. With the aid of a staff member who speaks Thai, the surgeon attained a consent for the patient. But it's not until the patient got in the pre-admission clinic in the hospital and they have a professional interpreter there that we found that the patient did not understand the consent at all. That caused a lot of anxiety. The patient thought that he's having a day-only arthroscopic surgery, which is a small keyhole procedure, whereas the surgeon thinks that he's having a total knee replacement. And it caused a lot of problem with cancellations, postponement of the surgery. And all this could be prevented if we use a professional interpreter in the first instance.
When a person has a non-English speaking background, it is vitally important that they understand what you've said. There are many ways to facilitate this.
It's important to remember that the consent process isn't just about getting a signature on a piece of paper, it's also about having a full and proper conversation with the patient. I find that the best way to ensure the patient understands the information is to get them to reiterate the information back to me in their own words.
I, as a routine, use diagrams, brochures, props. Some people are very visual and will understand visual cues better than verbal cues.
You need to avoid jargon and also getting them to ask questions of you, and this can all be facilitated with the healthcare interpreter.
Remember, the whole process is a conversation, it's a dialogue. The patient must have a voice.